Hello, I'm Dr. Shawn Cannon, the Chief Academic Officer and Director of Medical Education at Stony Brook Southampton Hospital. I wanted to take this opportunity to thank you for considering our residency program. I'm especially proud of the residency program in social medicine, which is dedicated to educating you above and beyond traditional standards. The field of social medicine seeks to understand how social and economic conditions impact health, disease, and the practice of medicine. Clearly, there is no better time than now. Our program will give you the training to handle issues that affect not only our local community, but the entire nation. We pride ourselves on having a program where a community is formed between residents. We conduct group outings to further foster relationships, and a big bonus, we're located in the Hamptons. Most importantly, our program successfully prepares residents for transition into independent practice, real-time medicine. We invite you to peruse our website, take a virtual tour, and contact our Department of Medical Education with any questions you may have. We look forward to meeting you. There's no other program like this. It's very unique. The ideas come out of the tradition of social medicine, which really starts with the same concepts, but more on a socioeconomic standpoint. So we have a need to educate physicians about society and what that means in healthcare. And it's not just about the surgical procedure. It's about recovery and making people part of the community. And those are the things we try to teach people here, that it's not simply about giving them an antibiotic and an antihypertensive medicine, that many of the things affecting healthcare is biopsychosocial. And I really guess that's my passion, is teaching about, it's not just about giving the prescription, it's not just about the earache, it's not just about the blood pressure, it's trying to take care of a human being. Sure. And in order to be compassionate physicians, we need to be empathetic people. And I think in medicine, we just want to look at the numbers, the CAT scans, and we forget about people. In this program, we really try to emphasize people we're taking care of, not just disease states. And we often say that in medicine, but here we really practice it. And I think our program is really one step above. And when I go to the academic meetings, it's what everyone talks about. We're doing it. And so we're really a step ahead for a small community hospital. So we have an ACGME residency program that is accredited for internal medicine, and an ACGME program that's accredited for general surgery. And if you look in most institutions, those are the bread and butter. That's not the people who often go out to the community. And that's where we have family medicine. We have what we call a transitional year, which is 1 year that people come before they may go into physiatry or anesthesia or another kind of program that requires a 1 year understanding of general principles of medicine. And I think this is a great spot for them to understand a little bit about addiction and a little bit about palliative care and those things that they wouldn't get at other places in a beautiful community. And we also have fellowships in those areas for palliative care and neuromusculoskeletal medicine. We work everyone here, whether you're a medical student or a resident, we try to expose them to addiction medicine for a month rotation. We have, in conjunction with Stony Brook and Eastern Long Island, set up a community psychiatry program that also is so needed in our community here and across the country. Yeah, but our hospital is a huge community. Our community extends to Montauk, often to Quogue. Just geographically, that's huge. Never mind the different populations that live in that community. It's every population you and I can think of. And so it's not just about Hamptonites. It's about people of the Shinnecock Nation and people who have been here as fishermen and clammers and other people who have $70 million beachfront homes. This community is quite diverse. And so we have a lot to learn about people here and those resources that we have in this community to help people. And so I think this is really a unique place to train. And historically, most physicians train in very urban, large medical centers, which is often not where they're going to practice. And that's why I call it real world medicine. Because I'm going to put you in an office in Southampton, or maybe Amagansett, and you're going to understand what the community here is like and get a feel for that. I think if I look, I can count about 52 between Riverhead and Montauk and in different specialties. So to get 52 young practitioners here, well, we're doing something right. And so they like us, and they like it, and they like our community. And so there's nothing that makes my heart feel so warm when my residents come back. I think those people who finish here know the importance of the art of medicine and how delivering it to a person can make you feel like you made all the difference in the world. And it makes you professionally more happy, it makes the people you're taking care of more happy, and it's just a nice place to be in a profession that's particularly becoming so fast-paced, and so you have 7 minutes, you have 4 minutes, get your patient out in 4 hours, and we're losing some of the compassion. And so we try to go back and say there is no medicine without compassion.